Hey everybody, welcome to my channel. My name is Dmitry Piskarev. I'm a third year medical student, and the first thing I want to say is that nobody hates nothing. Like, doctors don't really hate herbal medicine, and I just wanted to make this video because I have heard statements like pharmacological companies only want your money, I stopped taking my pills and now I feel better, and doctors only know how to give us pills. And I just wanted to explain why doctors do what they do, why we don't give you some plant instead of pills. We maybe can give you a recommendation of which tea or which plant you can use with your treatment, but I think there are not a lot of doctors that will give you only like a herbal treatment, a herbal medicine solution. So first of all, like for just understanding, it's a very short lesson of pharmacology. So let's look at this graph. It's concentration versus time, and this first line, it's called the therapeutic concentration. Down here, we just don't have effect. The effect is not enough for us to consider it. Up here, it's the therapeutic window, and the goal of the whole treatment is to maintain the concentration of the drug inside these limits, so it can actually work and don't harm us. This top line, it's called the toxic level, and as its name says, up from this point the drug becomes toxic and we can observe side effects. There are several ways to get the drug to the place where we want it to act, and they basically differ in the comfort for the patient and how fast the drug acts. The slowest way is ingesting the drug, and it takes between 30 and 90 minutes for the drug to act, and also we lose a bit of the drug in liver metabolism. That's because there are vessels from our intestines where the drug absorbs to the liver directly, so the drug enters the liver and metabolizes. The next one is rectal administration. So it's a lot faster than ingesting the drug. It will take between 5 and 30 minutes for the drug to act. And also we don't lose drug in this liver metabolism because there are not like direct blood vessels from this part of the intestine to the liver, so we can have more drug in our blood. But this road is actually not the best for the patients, and I think you understand why. There are several ones like intramuscular, inhalation, sublingual, and this takes a lot less to metabolize, like less than 20 minutes maybe. Sublingual and inhalation takes like less than 5 minutes to act. But which is the fastest way? I think you already know it, is intravenous administration. It acts like instantly, maybe like 1 minute, and the drug is acting, is having a therapeutic effect. So the class is over, and let's go to the reasons why doctors actually don't hate herbal medicine but prefer the conventional pills and other things we can find in a pharmacy. Concentration. Concentration, I think, is the first and the most important reason of why doctors don't really like herbal medicine. And that's because you can certainly know the amount of drug that you have inside a pill, but you don't really know the amount of drug that you have, let's say, in a kilo of a certain plant. And that becomes a problem when the therapeutic window becomes narrow, because you can't control the concentration of drug in patient's blood with precision. And also, plants are very different. Like, you can have plants in one side of the road with a certain concentration of a substance, and in the other side of the road you can have like a completely different concentration inside the same plant, so you don't really know like the exact concentration. And for medicine, it's really important to know the exact concentration. The next one is additives, because some drugs are not well absorbed without other molecules that are needed for this better absorption. And if you take this drug without this additive, you just will lose a big amount of drug. And in case of plants, maybe this plant doesn't have this additive that helps the substance to absorb better. Maybe it's like this exact same substance that you can find in a pill, but if you don't have this additive, it will not absorb well, and you will lose a lot of it, and you will need to drink, let's say, like 2 liters of a certain tea to equal the amount of drug that you are taking from one little pill. So it's very useful to give you pills. The next one is contamination. So as you all know, we live in a very polluted world, and plants absorb a lot of this pollution that we as humans emit. And when we consume these plants, we are also consuming our own emissions. So that's why it's not a good idea like to take plants from the side of the road, or like near, let's say, a nuclear factory, or let's say other facilities that are very contaminating. The next one is accessibility. And I mean that because some plants grow only like in dark, deep rainforests of the Amazonas, so it's just very difficult to get them. And if I say that you need a plant that only grows, let's say, in the Mount Everest, you're going to get this plant? No, probably no. So that's why it's a lot more comfortable just to go to the closest pharmacy and get some pills that will help you right now, and not in 6 months when you will get to this month to find this plant. So the next one is the molecular form, and it's very important because some drugs are modified to have better absorption, to have a better effect, to last longer, and maybe you just can't get the same effect from a plant, and sometimes we just need the effect to be fast to save people's life. So the last one is that it's not only about plants, because some drugs are derived from let's say venoms. That's incredible. Like maybe half, I will not say the majority, of the drugs are derived from venoms. And so what? Now I will say, so to cure this, let this big black scary spider to beat you. It will not have the same effect, because when a pharmacological company take a venom, it takes the component of the venom that actually works for us and not kill us. So that's why it's not only about plants. Pharmacology is a very complex science, and playing with it, it's not a very good idea, and less letting a spider to beat you. So that's all. Maybe I forgot something. Please type it in the comments, subscribe to this channel, and have a very good day, and I see you in the next video. Bye bye.